Okay. I thought it would be fun to do some rapid fire questions. Try to answer these, briefly.
Got it.
If you feel like elaborating, go ahead, but
you got it.
But, we can do this. What's the biggest misconception about mental health?
That you don't have to work on it in order to feel mentally healthy.
Right. So, a lot of people will be like, oh, if I just kind of do everything right, I will have mental health, but it's not really like that. It's something you have to work on.
You always have to work on it.
Just like physical fitness.
Bingo.
How do you know when it's time to see a psychiatrist?
If you've done everything yourself, you're not feeling better. If you've reached out to people that you counsel with, you're not feeling any better. If you see a therapist, you're not feeling any better. Then it gets kicked up to a psychiatrist.
Can anxiety ever be a good thing?
Absolutely. Without anxiety, our species would not be here. We would die out. Important to differentiate between healthy anxiety and clinical anxiety. All anxiety is distressful. It never feels good. Healthy clinical anxiety, or healthy anxiety, your response and worry is proportionate to the threat in reality. It doesn't feel good, but it gears you up and it tends and puts your attention to attend to the threat. Clinical anxiety, totally disproportionate, anxious reaction given what's actually happening in reality, and it disables you and it worsens your functioning, so you're less able to actually address the threat in reality, if there actually is one.
If there actually is one. What's the difference between sadness and depression?
Sadness is a healthy, normal human feeling that is short-lived, an hour, 15 minutes a day.
If someone dies, maybe longer.
Grief.
But it's normal to feel sadness about something like that.
Grief is a prolonged type of sadness that's normal and healthy. Depression is sadness with other constellation of symptoms that is prolonged, functionally disabling, and usually independent of context. If someone's majorly depressed, they go to Hawaii, the context has changed, their sadness comes along with them.
Remains.
And when someone's clinically depressed, it also is not reactive to good news. They're not getting uplifted if something good happens. It's like this fixed sadness. That's a depression. Can be a depression. Caveat being, some people can be depressed and not tell me that they feel like their mood is low or sad. So not required to actually be in a clinical depression.
Mm-hmm. What are specific signs parents should look for in children struggling with mental health?
What is going on in their life? What's happening at school? What is happening in their interpersonal relationships? Start there.
What's the role of medication in mental health treatment?
If you're taking all the steps and you have the insight and you know what to do and you still can't do it because of your body not allowing it to, or your mind, medications can help bridge that gap and make you feel more capable to take the steps necessary to heal yourself.
How do you recommend handling burnout?
Burnout. Burnout. Take a vacation, take time off, reduce your workload, have some balance. If none of that is possible, doc, easy for you to say. Find ways in your daily life to make things a little bit more enjoyable, a little bit more pleasurable, and for God's sakes, make sure that you're getting enough good sleep.
What's the first thing someone should do during a panic attack?
Control your breathing.
Can you explain what imposter syndrome is?
Imposter syndrome is a lack of self-esteem or self-efficacy in a role in which you have earned, but perhaps don't feel deserving of.
What's one tip for dealing with intrusive thoughts?
Meditation, mindfulness meditation. Get on it.
How do you differentiate between stress and an anxiety disorder?
Stress can be positive or negative. Eustress, distress. Anxiety is worry. Two separate processes entirely.
What's the link between diet and mental health?
If you're eating garbage all the time, one is a prerequisite of the other. Yeah. There are people that have crappy diets that are mentally well, but if someone is mentally ill, we got to make sure that they're not poisoning themselves with garbage. Pull out the poison first. Garbage food, refined carbohydrates, alcohol, drugs, you name it.
How can people overcome procrastination?
How can people overcome procrastination? Well, procrastination is avoidance. Avoidance is a defense against something that is uncomfortable, requires a lot of work, elicits fear. Procrastination is avoidance. The first step in turning against a defense like avoidance and procrastination, sit down, journal, write down what is the cost of this defense in my life? What has the cost been? What is the cost going to continue to be in the future? So actually, let me add some things. Identifying that you're procrastinating, accepting that it's a problem, recognizing the cost of it, and that'll help you turn against it. That is true for any defense. Procrastination, aka avoidance, is one of them.
Why do people develop phobias?
Wow, great question. Many reasons. One of them can spring out of trauma. If I was assaulted in front of my street in the evening, I now have evidence that this catastrophic result can happen if I'm doing something that is otherwise benign. So when I tell them, listen, you're overestimating the chances of something catastrophic happening, and they tell me, well, doc, actually I have evidence that the catastrophic result can happen, that makes it more difficult to regulate their anxiety because now their front part of the brain that's assessing risk is telling them the worst case scenario already happened. So that is one way in which phobias arise because the brain has learned to let me avoid any risk that this can happen because the worst case scenario has already happened before.
So a phobia is actually a two-pronged problem. Yeah,
Can be.
Limbic and frontal.
Yes.
Cortex, yeah.
It's always
Complicated.
working together. Yeah. Yes. Which actually, perhaps at some point we'll talk more about that as far as why it's more difficult regulating anxiety and letting objective facts overrule the fear system when objectively you've already been through something catastrophic. That's why it's more difficult to regulate anxiety in patients with a history of trauma. We'll come to that another time. Leave me questions or talk to us in the comments if you want to learn more about that.
How important is sleep for mental health?
Crucial, fundamental. Step one, get your sleep in order. Sleep is the foundation for literally everything. Mood, anxiety, physical performance, creativity, learning,
Feeling
growth
good.
hormone, physical health, satiety, the hormones that regulate your appetite, hunger, satiety. Literally everything relies on sleep.
Can you explain the difference between a psychiatrist and a psychologist?
A psychiatrist is an MD. They went to medical school. They understand the hardware. They understand the brain, the parts of the brain, your adrenal glands, your hormones. They understand how the physical is producing the psychological and how to tweak the physical in order to produce psychological relief and benefit.
And psychologist?
And also psychiatrists can order labs, make sure there's nothing wrong medically, order imaging, prescribe medications. A psychologist works on the psychological, the spiritual. They don't have a fundamental understanding of the human body and physiology. Some can, some are excellent, but that's the difference.
What's a common myth about therapy?
Everybody needs therapy. That's a myth. Not everybody needs therapy.
How do you recommend navigating workplace stress?
What part of this? Are you, through your decisions and choices, adding to your own stress load? What is in your control as to what you can stop doing or what you can actively do to diminish that stress? Keep that locus of control in yourself and don't externalize it all to forces outside of your control.
What's the best way to support a loved one struggling with their mental health?
Sometimes the best thing you can do is comfort them, be a good brother, sister, and just support them without offering solutions. And interestingly, without treating them like they are a sympathetic case. If you show somebody sympathy for their position in life or whatever, they then interpret that as you feel like they are worth sympathy. So you are almost validating that their life is in shambles or they have a problem, and that might make them feel even worse. So watch out with treating people with sympathy. Obviously, sometimes it's okay and healthy, but be careful for that.
I think my family particularly does not do that. They are stoic people, and if we're showing sympathy like in a pronounced way, there's a problem.
My culture too. The last thing anybody wants to do is receive sympathy or pity, because again,
sympathy is a pathway to shame.
Can be
in my culture.
Yeah, mind you, sympathy can be healthy and adaptive, so not always bad at all. A lot of times called for, but just be careful about that.
Probably already answered this. I got a feeling I know the answer, but what's one daily habit everyone should do for their health?
Remove poisons. Alcohol, drug use, habitual cannabis use, shitty food. Take the poison out and see what's left.
How do you stay updated with the latest medical knowledge?
Well, lucky for me, I'm obsessed with my field of study and my career. So, I mean, every day I'm seeing 14, 15, 16 patients. I don't know everything. It keeps me learning because I have this purpose of being the best psychiatrist I can be. So my drive to give the most high level care drives a curiosity in me to always be reading and looking at the data and the evidence and the research, talking to my peers, to be the best psychiatrist I can be and help these patients that I care about improve their lives and their mental health.
So just to be succinct, you talk to your peers. You're always investigating new articles,
new research, and I'm always reading.
Always reading.
Reading books makes you smarter, people, believe it or not just TikTok.
Are multivitamins necessary?
Ask a PCP. I would say if you have a balanced diet, not really.
How do you recommend managing screen time for better health?
There's regrettable screen time where it's just a pure waste. And then there's screen time that is productive. Let's talk about bullshit, regrettable screen time. As little as you possibly can.
What are the signs of a healthy lifestyle?
Feeling well physically, having energy, sleeping well, and feeling well psychologically.
Are mental health and physical health equally important?
Yes.
What's one health myth you'd like to debunk?
One health myth: that any amount of alcohol is good for you, whether it's your cardiovascular system, calm down your nerves. Alcohol is not good for your body in any quantity.
Can you justify us using it anyways?
Yes, I can. Yes. I mean,
quickly, short.
It could be good spiritually. It could be good interpersonally. It can help form bonds with people. It can be a nice reward.
But let's not make the mistake of thinking it's healthy.
Exactly. Don't make the mistake of thinking that it's physically healthy.
This is a good one. I actually like this one. Can poor posture really affect mental health? What is your posture?
Of course it can. Whether or not, let's just say your posture has no actual direct impact on your mental health. The way you walk in the world, including your posture, will have an impact on the way that the world responds to you. So we are a social, interpersonal species, and you guys can all tell me when you see someone with poor posture, what opinion does that give you of them, and how does that change the way you interact with them?
Why is exercise so impactful for brain health?
Your brain is part of your physical body. It's tissue. If it is not healthy tissue, then it will not operate optimally and it can get sick. Just like your heart can get sick, your liver can get sick, your brain is an organ. Just because we have thoughts and feelings and things that feel like, metaphysical and outside the realm of like cells and tissue, it does not mean that your brain is not physical tissue and an organ just like every other piece of your body.
What's the best piece of advice you've ever received?
Be honest with yourself and be honest with other people.
How do you personally handle stress?
Depends. Overall stress load, good sleep, and exercise.
What's your favorite book and why?
The one that's most influential to me is like what we mentioned it before, The 6 Pillars of Self-Esteem by Nathaniel Branden. Also, How to Win Friends and Influence People, Carnegie.
What's the one thing you wish people understood about psychiatry?
We're not just pill poppers. It's not just a pill mill. We're not just here to, hey, take this Prozac, see you later. We're actually working on curing the patients of their mental illness. And if it's not curable, treating and getting them living the life they want to live. It is not just, here, take this pill, see you later. And we are not sponsored by any sort of pharmaceuticals industry. Anyone that takes pharmaceutical money, you can look it up online. We are not in bed with big pharma. And any psychiatrist that's worth anything does a hell of a lot more than just prescribe pills.
What inspires you most in your field of work?
My patients.
How do you stay motivated during tough times?
I think about my hard work and who it's serving. My family, my community, my patients, my fiance, my future children. I keep in mind everyone that is not just myself.
What is one thing people often overcomplicate in life?
Their diets.
Totally.
Their diets and exercise routines.
As long as it works for you, good for you, keep going.
Eat whole foods, stay away from processed garbage, and get good, intense cardiovascular exercise, and keep it simple.
What's your go-to way to build good habits?
Recognize that there's research on how long it takes to build a habit. There's no conclusive results here. Let's say 6 weeks. Take it a day at a time. And set reminders in your phone so you remember to do it.
And I think I would probably add, be forgiving of yourself if you happen to stray from the path.
Bingo. It's
ruminate.
not all or nothing.
Yeah, don't ruminate on your failure. Just forgive yourself and then continue on the path like you never veered off of it.
Exactly. Go for 95% success rate. If you miss one day, it's not all over. Pick it up tomorrow.
And I will add something that happens with me is I'm very prone to negative self-talk if I ever do vary off the path. It's like a pervasive feeling in my life, negative self-talk. Oh, you can't stick to this. You can't do that, right? So even one minor deviation, it really does feel like it's a massive, it's everything I've ever worried about encroaching on me all at once again. And it's trying to ram down the gate and I'm trying to hold up the gate, but it is something that it's just, this old problem again, that doesn't do you any good.
this self-defeating side of you busting through the gates, and we all have it.
Yeah.
It's a part of you that wants to get well and stay well, and then we have that self-defeating side.
Yeah. Pernicious. How do you recommend setting realistic New Year's resolutions? This is timely.
Yes, goal setting. There should be a deadline. This goal should be accomplished at this time, and it should be realistic. And you can then break it up into actionable steps. I'd start there and have some sort of metrics to measure along the way, benchmarks that you're actually succeeding and progressing towards your goal. Goal progress theory, a topic for another time. Humans need to see goal progress. So I'm glad you brought that up. We'll talk about that another time.
Yeah, it has to do with the dopamine system, right?
Course.
Dopaminergic system.
Yep.
If you could give one piece of advice to your younger self, what would it be? My main piece of advice to your younger self would be try not to worry so much. You're going to be fine. Follow your heart.
Bingo. Love it.
Yeah.
Yeah. Recognize, do some reflection. What is your temperament? What is your personality like? What are your interests? Look into the future. What is it that you want your life to look like? Follow your gut and your instinct, and don't let external influences and pressures drive you to a destination that is too far removed from that destination you have in mind for yourself.